Hey, it's Zoe with Health Talk. Are you suffering from health problems like weight gain, lack of energy, depression, or back and joint pain? Well, now's the time to do something about it today. Listen to this special offer from my friends at the Roselle Center for Healing and visit them online for details.
In celebration of the Chinese New Year of the Rooster, receive a new patient acupuncture evaluation and 30-minute massage for just $99. Offer valid through February 4th. For details and to purchase, visit rosellecare.com. That's rosellecare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Control Blood Pressure Without Drugs on Wednesday, February 8th at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on whatever you want to talk about when it comes to your health. Perhaps you've had a problem, you've done everything you can think of, you've tried, you've applied things, and come up with the same end point. Nothing that really works, so call me. 888-630-9625. That's 888-630-9625. Love to talk to you. Lots of things to cover. It's one of those days, like there's so much out there, not enough time to really get into it. And, sitting around reading the last couple of days, we do a program on an annual basis that's for doctors. This year is going to be done in Florida, in Orlando. We're going to be doing something called Leadership to Legacy. And what that really means is getting doctors and their staff to really get it, to be present in your life, to be partners with you instead of just an information source or a prescription writing source or someone who just, learns how to mire themselves through the system. But, they have to be your partner. You have to be their partner. And that's what we started this. But in preparing for that, I have to go through tons and tons of information. And it's intentional journey is the topic that I'm going to be presenting with 7 other amazing doctors down in Florida. It's the journey that we all take in our health is very specific to you. And what do I mean by that? Well, those of you know and have read my book, Ageless Health, Health is a Do-It-Yourself Program, are aware that I wrote that because I want to put the obligation of your health in your lap. That's a big charge, isn't it? It's huge. That you are responsible. Where you are right now, today at this moment in time, is exactly where you're meant to be. How do I have the audacity to say that to you? Because you are. You're there. But what it doesn't preclude is change. At any moment in time, as long as you're breathing, you can change virtually anything that you want to change about yourself. If you don't have a lot of time, like you're 90-some years old, but you're still hanging out, guess what? You can make it a whole lot better. But the more time and investment and willingness that you have to become your own leader, your own driver, your captain of your ship, so to speak, you can change virtually anything in some respect. Elimination is possible in many different situations, but, in 4 decades of practice, I have yet to see anything that can't be modified or made better in some way. So I guess I'm on, a little bit of a track right now, belly pulpit, if you will, sitting there, lecturing to, all of you and trying to get your attention to make you understand, as well as my colleagues out there, that the body is this magnificent, amazing piece of machinery that has everything that it needs. It doesn't need interference. That's the only thing that we have to eliminate is the interference from the foods that we shouldn't be putting in our bodies, supplying the things that we do need, and so forth. I don't know, many of you know and some of you don't, that I have, since the Affordable Care Act came into being a few years back, I've been around at different organizations, giving briefs on them. And here we have right now, we're going to see it structurally change dramatically differently. I know a lot of you have differing opinions on it. Some of you think, oh my God, what we're going to do, I'm not going to be covered. And some of you say, thank God, now I can begin to, get care affordably. And, you have to look at each side. But the bottom line is, as a practicing doctor for 40 years, I have my brain says nobody should be refused care, but there's ways of doing that. And as this begins to unfold, I promise you that I will let you know what it is, and I will brief you on the changes that are coming, because right now it's all rhetoric. It's all stuff that's out there. There's a lot of fanfare. We're starting to get some briefs coming down from the government on what the different possibilities are, but nothing's hard in place at this point, other than the new administration saying that we don't have to implement penalty for those who have decided that they don't want health care as it's subscribed right now. It's kind of, turn your eyes in the other direction and let it go that way. But much more is coming down, and we'll let you know, because you need to know how to position yourself. But here's the deal. It's going to come to place, my opinion only, understand this, it's my opinion, that you are going to have some form of old-fashioned health care, meaning that you're going to have a deductible and you're going to have a copay, and there are going to be certain things that it's going to be like a cafeteria style. They're going to go to your company, and there's certain things that are going to be put in, certain things are going to be left out. And you are going to have to step up and take care of yourself. You're going to have to educate yourself. The Roselle Center for Healing, for years, and since I've been in practice, what we've done is educate you. That's why we have our in-house continuing education programs. That's why we have our wellness orientation programs for patients, because we believe that you deserve to have the information, the tools, if you will, the capacity to be able to shift and change virtually anything without having to go to the White Tower deity and saying, help me. You should help yourself first. Therefore, Ageless Health, Health as a Do-It-Yourself program, was written as this manual to take you through the construct, if you will, of step-by-step of what you need to get done for yourself. And that's why we do this program. That's why you listen to Dr. Tom Roselle live. So having said that, stay tuned, because I'm going to give you more and more. And as we go through this year and we set up our different educational programs, pay attention, join us, because they're designed for you. They're designed to give you the information as best as we possibly can. Just like we're giving doctors an educational format this coming week in Florida. And, we've incorporated different pieces of the puzzle. We even have, I don't know, many of you have watched or know about the documentary called Vaxxed. And what Vaxxed is all about is the government knowingly hiding information about vaccines and the effect that it has on health, particularly that of children. And they were saying, the conclusion, if you will, in the documentary is that by the time we get 2032 on the calendar, that up to 1 in 2 children could be autistic because of this growing exponential rate. So this is not me telling you this. This is the data that was exposed in the documentary. And we have the privilege next week of having someone by the name of Dal Bigtree, by the way, who is the producer-director of the Emmy Award television series called Doctors. He's the one that was the producer-director of Vaxxed, and he's going to be there lecturing to all these doctors that are going to be there. It's an intimate group of about 75 to 85 doctors. We'll see how many show up next week, but we keep it in a small, concise group because we want to be intimate with these doctors and give them the opportunity to learn how to engage you, to communicate with you, to be present in your lives. So what does all this mean? This is about educating you, them, all of us, and making sure that we have the capacity and not be dependent on anybody else, that you need to know what's really true. And as I've said to you many times, don't believe anybody, including me. My job is to provoke you. My job is to set you on fire so you go do your homework. But when you do your homework, look at every side of the issue, because you're really smart people and you get the ability to synthesize all of that. 888-630-9625. That's 888-630-9625. Love to talk to you. I've got stuff for you today in the news that might, obviously cherry pick these things because I want you to know certain things I've been talking about for years. Interesting article that came out, and the article was released in the British Medical Journal, and it said that junk food diet may shrink your brain. So you know all that junk that you guys are going out and getting, the sodas and the sugars and the garbage and so forth? Well, here's the deal. In a recent article in the BMC Medicine reports that particularly as we get older, people who are older who eat unhealthily, Western diets, our stuff over here, the junk that we serve all the time, have smaller brains. Yeah, your brain is shrinking. So researchers say that's further proof that junk food has a terrible, terrible impact on our health overall. So if in this westernized, amazing society that we hold so dear to our hearts, if we're eating all these things from GMO products and things that are preserved and things that we spray and so forth, you get the message, right? You get the drift. So guess what it's doing? It's shrinking your brain. It's making you less able. So the result, is of the study that was kind of an interesting study, that the researchers at this, I think it's Deakin University and also out in Australia because, they're one and the same. Australian National University suggests that as we get older adults that consume a lot of junk food, such as, as I said earlier, sweet drinks, the sugars and sodas, things like that, right? You know my mantra. You know how it goes, right? Consume more junk food, and salty snacks, the chips and the processed meats. You go to someone, you buy those packaged meats, processed meats. They have a very small, comparatively, of a piece of the brain called the hippocampus, and it actually begins to show that the entire brain begins to shrink compared to those people who they eat vegetables and a limited amount of fruits and fish. They have a much larger hippocampal area of the brain, and that's one of the main, transfer points and relay points and ability to cognitively put things together. So the relationship, has existed over and above other things that you could put into play with this. This is like straight up. So even taking people who are physically active and people who smoke or don't smoke and they're educational or depressed, if you eat junk, if you eat crap, guess what? Your brain's going to shrink. So, and what they did is they used an MRI. It's called a magnetic resonance imaging machine. Many of you have had the fortunate or unfortunate opportunity to go into the tube, and claustrophobic for some of you. And so what they did is they studied adults between 60 and 64 years of age, and they measured and recorded their dietary patterns, and they took into range a lot of other factors, that could affect the hippocampus, and they, kind of put that on. What they found, and their conclusion, overwhelmingly so, was that if you eat junk food, your brain's going to shrink, period, and you're going to have more progression towards dementia. You're going to lose your brain. So sugar, sodas, coffee, that's an argument, but it's an acidic coffee that we talk about. Fast foods, fried foods, junk stuff, right? Guess what? You're going to shrink that brain of yours, and your cognitive pattern is going to break down. This isn't cool, guys. This is not okay. You wonder why old age dementia sets in? Well, here's part of the answer. That's part of what's going on. So do your homework. Go check it out. See what it's all about. But I'm telling you, it's, not okay. So every time you want to go for that Coke or you want that candy bar or you want a bag of chips, think about it. The more of that stuff you put in, the smaller brain that you have. We'll leave that right where it is. I could add a few other things to that, but we'll leave it alone. Okay? So guess what? Talking about memory loss, vitamin D. Yep. There was a study that was very recently published in the Journal of the American Medical Association, in their neurology journal, found that, here we go again, older people, older adults with low vitamin D levels lose their memories and their capacity to think faster and cognitively assimilate information, just going down much, much faster to Alzheimer's and dementia and things of that nature. We're going to get back on it because I find it really, really fascinating. Here's the stuff that I bring to you. Call me, 888-630-9625, 888-630-9625. You're listening to Dr. Tom Roselle live, and I'm going to bring you more things that are going to stir up the apple cart today. Don't go away. We'll be right back. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I'm in studio waiting for your calls. Let's talk. Let's do, the march down the channel here and try to get you to realize that you can make some changes, that it's, on your plate to make a difference, not somebody else's opportunity to do it to you. This is a do-it-yourself situation. 888-630-9625. 888-630-9625. People ask me why I coined the term Ageless Health, because the bottom line is that your health should be an ongoing process of tweaking and improving and moving forward. Nobody's a saint, but you get to the place where you take a look at the trail that you've left over a period of many, many years, wondering how you got where you got. Well, you got there because of the decisions that you've made up until this moment in time, the things that you have chosen not to do as well. And things that you choose to do, and the things that you put into your system and the body, and the lack of activity, the lack of perception, and you wait until, those drugs that are keeping the symptoms under control no longer work, and then you say, oh my God, now what do I do? Well, it's, that's what happens. You get to that place where as you go forward, you start slowing down, and it's not a good thing. Listen, want to let you know about something, because, we are a natural wellness clinic. It's called the Roselle Center for Healing. We are saluting the Chinese New Year. That starts like right now. So, and helping promote that and drawing your attention to it, our Chinese acupuncture department has a special for you. Go to our website. Go to rosellecare.com. That's rosellecare.com. And you're going to find that for $99, which is far less than what you could get just for a normal evaluation in one of the doctors that are there, that you're going to get not only an acupuncture evaluation, but you're going to get a 30-minute massage. You can't get either one of them for that price. So go to rosellecare.com and tell them that you want to take advantage of the Chinese New Year special for acupuncture massage. And you got to do it by the 4th of this month, which is this week. You don't call by then, it's all gone. It's bye-bye. So here's an opportunity. Call them or call the office at 703-698-7117 or go online to rosellecare.com. That's rosellecare.com, and tell them you want to take advantage of that. Okay? Do it. Come by. Say hello. See what the Dr. Pina and Ivani Osborne can do for you. They're great people. They're amazing. I try to get in there as often as I can, but I won't take your appointment times to do it. So I'm like the shoemaker's family. I'm the last in line, but nevertheless, it's there for you. 888-630-9625. George, how can we help you?
Well, just diagnosed with edema, and two directions. One is is wear compression socks during the day, and of course it deflates at night, but during the daytime. Is there no cause has been diagnosed to date, but I'm just wondering if there's any other alternative.
Both legs, George?
I'm sorry, yes,
Okay, so let me ask you a question. When you put your socks on, does it leave the imprint of your sock in your leg?
Yes, it does.
Okay, so that's called pitting edema. And most pitting edemas, before you rule out anything else or rule in anything else, has to do with cardiovascular return. And so the heart's not working, and then pretty soon the arterial beds aren't strong enough to begin to return not only blood but also the lymph within the system. So what you're getting is a pitting lymphedema in the lower extremity. There's lots of things that can be done. But let me ask you a couple quick questions. Are you taking any statins or any other type of medication?
Oh, yeah, I'll take a variety. I take two medications for high blood pressure, which controls it.
Okay, so here's the deal. So with those medications, one of the things that you lose a tremendous amount of is something called coenzyme Q10 or CoQ10. And without that, the little energy packs, the mitochondria, which are very heavily saturated in the heart and in the brain, begin to deplete, and you end up seeing the heart not work as effectively and efficiently as it should. But the bottom line is, got to remember, this heart, this big pump that's about the size of your fist, sitting in the middle of your chest, has a lot of different neurological inputs to it. It has nerves from the upper part of your back. It has the vagus nerve from your brain. It has the pacemakers within the heart. It needs all kinds of minerals, from potassium to magnesium to sodium, in the proper balances. And so when it's not working, you have to ask the question, why isn't it working? Not just throw something at it. And if you can find out the why, you can fix the why. And there's only 3 whys, by the way. There's either injury to the body that's either subtle or significant over a period of time. That body hasn't corrected or nobody's taken an active step in. Biochemistry, things you eat you shouldn't, things you need more of you don't get enough of. And the third is stress. All those things feed on each other. So when you look at an edemic problem like that, a pitting edema that's both sides, that leaves an impression in your leg, that's not a good sign, and it's something that has to be dealt with. So I'm not going to tell you to go get socks. I'm not going to tell you to do those things. I'm going to tell you find somebody like me that can give you an underlying answer with a complete evaluation and understand that there are things that are being depleted in your body. One of them is coenzyme Q10. Probably, I would guess, particularly with the high blood pressure medication, is going to be potassium, magnesium is going to be out of balance, and so forth. So that's where you start, but there's a lot of that can be fixed and turned around. George, I hope that's helpful, because anything short of that, you're just chasing symptoms, and that's not okay. Symptom control leads to destruction down the road. One of the side effects of statins and aspirin and things like that is the depletion of coenzyme Q10, and even the literature will tell you there's a nasty side effect. It's called death. So pay attention, my friend. We're coming up to a break. You're listening to Dr. Tom Roselle Live. I got much more for you. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Yes, I'm live. I'm here. I'm very active today. I got all kinds of things I want to share with you, and I'm sitting here and saying, how can I do all this with the limited time that I have with you? It is a challenge, but I'll give you as much as I possibly can. But I also want to take your phone calls at 888-630-9625, 888-630-9625. Let's talk. Let's talk about your stuff. Let's figure out what we can do to fix it. Started talking about in last half of the program about memory patterns, and I told you about the study that was done about junk food, and that if you eat junk food, your brain's going to shrink. It's not going to be anywhere near the size that it should. And they did the study between 60 and 64-year-olds, and it was quite an extensive study. And it was straight, and they got rid of all the other factors, that have an effect, and they synthesized it down to that. And that was their conclusion, and it was done. It was a very well done study. Talked a little bit about vitamin D, and we said in the Journal of the American Medical Association, neurology journal, that they found older adults with low vitamin D levels, and here's another piece of it. So you eat junk, you don't get outside, you don't take any vitamin D, guess what? You're going to be much more prone to memory loss and Alzheimer's and dementia. That would get my attention. It does get my attention, because I'm like in that age group, and I need my noggin. I need my brain. I don't know about you, but, I don't eat stuff like that, and I make sure that my vitamin D level's up, and I do all kinds of other things to keep it going. Dr. Joshua Miller at the University of California, Davis campus, was the one that did the study on Alzheimer's disease. And he spun this off, and he looked at the association between blood levels of vitamin D and changes in memory and thinking. And it was a study that was 318 adults, and he studied them for over 5 years. So it's a significant study. Well, this wasn't just here's 10 people, let's take a look at them. And researchers define adequate blood levels of what we call 25-hydroxy vitamin D3. It's the form of vitamin D generated in the body, that converts to vitamin D, that is stimulated through the skin by, sunlight and so forth. And we get a little bit of it in eggs, but if they're free-range eggs, not the commercial junk, free-range, organic, good oils, particularly fish oil. And those are important things. And the study found that, the low level was somewhere between 20 and 50 units. And, some of these people were less than that. And the mean age of the participants was 76 years old. And, they would looking for normal, mild cognitive impairment or severe dementia. And the researchers found that more than 60% had extremely low vitamin D levels. That's 60%. That's huge numbers. And when you think that vitamin D also does other things like prevent cancers and, maintains immune function and bone density and so forth, we wonder why we're breaking down so fast. So take that information and go look at it, because it's important data. It's stuff that you've got to be aware of. And if you're not, or you ignore it, then you remember what I said earlier on the show? Your health is a do-it-yourself program. You are where you are at this moment in time. Because why? Because of all the choices, the decisions, and sometimes making no decision, no choice, not becoming informed the way you should, not reading my book, Ageless Health, Health is a do-it-yourself program, will lead you to that end place. It's not okay, my friends, particularly when the fix is there. We're going to talk a little bit about heart disease today and heart health, probably more than anything else. We'll talk about the stuff that's out there. It's answers beyond, cholesterol. Cholesterol, as you know, many of you know, is a kind of this marketing thing, and it doesn't answer the questions, and it really is important for you to understand that, but we're going to work this around your phone calls and so forth at 888-630-9625. Call me. So here's the deal. When it comes to matters of the heart, and we're not talking about because, the 14th of February is coming up in Valentine's Day, but we're talking about your heart, that little ticker inside of your chest that pushes blood through and does all kinds of oxygenation and getting things to the right place. Cardiovascular disease is the top cause of death in the United States. Well, many say, well, got to die from something. Well, how about just closing your eyes and everything everything stops? Wouldn't that be great? Instead of a massive coronary something or other, right? So Americans, that's us, all of us, guess what we spend to try to keep ourselves intact on an annual basis with our heart? Heart only. We're just talking about the sticker that has to do with the heart. In excess, north of $300 billion. Okay? And that's just the costs of heart disease, stroke, and other cardiovascular problems. And that's direct costs. Direct costs. That's not the other stuff of lack of being able to do stuff. So, you know what? Guess what happens? They extrapolate this based on dietary patterns and activity levels and so forth, and it's only going to get worse with us guys, called the baby boomers. Those of us within that range, it's going to get worse because we don't pay attention. We think we're above all that, or we think that, what do you expect for your age? I don't know about the rest of you, but, I figure I got another 40 years on this planet to help all of you and become an irritation to people who want to hurt you. That's my goal. That's my desire. That's things that I need to get done. So for years, it's been known that cardiovascular problems are preventable. You don't have to go down that route. They're preventable. And, yet the incidence of cardiovascular problems is going through the ceiling. It's like exponentially rising. So this is all about? It's going through the ceiling, but it's preventable. And, leading professional organizations like the American Heart Association, they're cutting back on fat and increasing our use of cholesterol drugs. That ain't happening. That's not what's supposed to be done. You need fat, but good stuff. And cholesterol drugs decrease the active components that you need within the heart. It knocks out CoQ10. And as you get older, here's one of the statistics that makes me crazy, right? They've got you on aspirin. They've got you on cholesterol-lowering medications. They knock out the CoQ10. Interesting side effect of these CoQ10 and aspirin products, the NSAIDs, non-steroidal anti-inflammatories. It's called death. You die. Your heart stops. Don't believe me? Go check it out. Go look it up. That's one of the and guess what? When you're older enough and you've been on this stuff, they don't report it as that. They report it as old age. You died of natural causes. Just because you've been on all this crap for such a long period of time really has nothing to do with your health. It has to do with the fact that you're older now. You're older. We're in that age group. We're older, so we're going to shut down. But the problem is it's causing those problems in younger people too. How many of you are on NSAIDs or have been for a long period of time? You know what they're promoting? Remember, I said 2 years ago, the FDA had to totally reverse their opinion on aspirin. Okay? If you've been listening to the program and you looked it up, the FDA had to do 180 degree on their opinion on aspirin, and they said that people who are on aspirin, they've known this for over 15 to 20 years, have the worst cardiovascular outcomes. The worst. And your doc's putting you on aspirin. So, well, it's okay. I'm going to put you, it's only a baby aspirin. It's only 81 milligrams. Well, you know what? 81 milligrams kills you if you're taking it long enough. And that's their data, not mine. Check it out. Say FDA reverses opinion on aspirin, and read through it, see what, and it increases certain type of cancers and so forth and so on. So you know what they're doing now? You know what Bayer and company is doing? They're telling you that aspirin is great for certain stomach cancers, and it prevents Alzheimer's and so forth. And yeah, it was probably because it's going to kill you before you even get to that place. Think about it. It's my opinion, but that's the way my brain works. Think about that stuff. If that's the case, remember what I said a long time ago? When you see anything like this, ask the question. Ask the question. Who wrote the article? What do they have to gain by it? But more importantly, who wrote the check? And when you find out who wrote the check or who's gaining from that, you know why they wrote it in the way that they wrote it. It's not okay. Cardiovascular disease is the top cause of death in the United States. It's costing $300 billion a year. We've known for years, as I said earlier, that you can turn this damn stuff around. You can change it. So, but when we got big pockets that are fighting these things, it's no wonder that, that many people out there are making alarming predictions about the future of heart health, right? They know the side effects. Unless the trends are halt or reverse, we got a problem, because over 1 billion people will die from cardiovascular disease in the first half of the 21st century. 1 billion people, they're going to die from this stuff. I mean, come on now. You're not stupid people. You're bright people. Look it up. Figure it out. It's not meant to be that way. It's not meant to be that way. I'll give you an example. My father died at a young age, comparatively, of a massive coronary incident, okay? Took me to school in the morning, said, bye, Dad. He said, see you later, right? I was just about 2 months from my 16th birthday. And they came to get me at a track meet that afternoon, and my dad had died. He dropped dead in my bed at home. Came home from the beauty salon, which my parents owned, and that was that. Okay? But my father had 3 other brothers. All of them lived long. And these are guys that today would have been, way old, but in those generations did, but they lived for that generation well into their 80s and died gently. My father died abruptly. Why is that? Well, he was a heavy smoker. My dad was a hairdresser, all the fumes in the beauty salon. My dad's quick lunch was a fried egg sandwich, a cup of coffee and a donut in the morning. Do you think he didn't have cardiovascular problems? Think about what you do. Jeffrey, how can I help you, sir?
Hi, love your show here. I'm really learning a lot.
Thank you, sir.
But I just had to add in, I am currently going through some cardiovascular issues.
What's going on?
I'm 57. Okay. I'm active guy. I mean, 5'10", 180 pounds. I do some working out. I have a small farm. So I eat well. I eat fish. I eat meat. I eat vegetables, fruits every day. Well, I've been going through, had some back issues, and I was on ibuprofen for probably a year till I actually went and got surgery done, and they removed a small synovial cyst. So while I was with my doctor, my neurologist, he says, hey, Jeff, do you got a heart murmur? And I said, no. Not that I know of. I was in the Navy for a long time and never had any issue there. He says, well, you need to go get that checked out because there's something going on. And sure enough, I have a PVC is what they call it. It's a ventricular.
Yep.
And it happens 10 or 20 to 30% of the time right now. Never had that issue before.
Okay. Can I ask a couple quick questions?
Sure.
Okay. Were you a jock when you were a kid?
Was I a jock?
Yeah. Did you play sports? Were you a track athlete? Were you a football player? Whatever.
Yeah, I was pretty active. Yes.
Oh, okay. Did you ever smoke?
A long time ago. I quit when I was 29.
Okay. So here's what happens. Let me just give you a little background, then I'm going to ask you more questions. So we're going to take one piece at a time. As an athlete, your heart is strong and large and so forth. And if those days you didn't quite as well as you did today, they're going to be somewhat of a stress. And what you end up with a mitral valve problem, it's a systolic ejection murmur. And it's very common with athletes. It depends on how significant it can be. That can be one of the issues that's going on. The fact that you were taking ibuprofen for a length of time on a consistent basis is going to deplete CoQ10, coenzyme Q10, which is going to cause the fluttering or the PVCs that you're getting, the misfiring of the heart. That's part of those things. If you had any problems with the upper back, particularly where your neck meets your thoracic area or the upper portion of your neck, those are the nerves that service the heart. And sometimes you don't even have to have pain. The signal is not going to be normal. Remember I said earlier in the show that the heart has 3 neurological sources. It has the vagus nerve from the brain, it has the nerves from the spine, and it has the pacemakers within the heart. So all those things have to be looked at. A lot of even good foods, depending on how they were produced. For example, if an avocado that is a GMO avocado is not the same as an avocado that is not a GMO avocado. If you're not eating organic, then you have all kinds of sprays and additives and things of that nature. So you have a lot of different things you have to take into consideration relative to that. Now, relative to your own situation, I'm going to follow through on this. We got about 50 seconds, and I got to take a break, but I'm going to ask you a couple other things. Have you done the follow-up examination relative to they're saying, well, this is what the problem is?
Yeah, I've had an echocardiogram. I've had a stress test.
And what have they told you?
The only thing that came back was my stress test. They said came back abnormal. I'm actually scheduled on Thursday to go in for a heart cath just to see if there's some blockage somewhere.
Okay, Jeff, don't leave. Just hang on. We're coming up to a break. There's a couple things I want to tell you, but there's another 1 or 2 things I want to ask you. What you're going through is something, if it comes back that there's no blockage, anything like that, then it has to do with some other things, and I want you to at least have the data. You're listening to Dr. Tom Roselle Live.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, as you do every Sunday at 12 noon on the Eastern Seaboard. You do the math where you're at, and we thank you for listening. Tell everybody about the program. And I want to remind you that all of our past programs are available at roselleradio.com. If you go check it out at roselleradio.com, you'll find hundreds of previous programs for your listening and re-listening pleasure. So check it out, send people there, and make sure that they listen to the program. Jeffrey, are you still there?
Yes.
Thank you, sir, for holding on. Listen, I want to touch bases with you a little bit because I want to give you the tools to make sure that you ask the right questions. So the problem that you're in right now could be something that is very minor. It could be something that is significant or anything in between. The whole idea is to find out what the underlying problem is. Is it a clotting problem? Don't know until you have, the angiograms and you check that out and at least ultrasounds to find out if there's any impairment. Once that occurs, then you have the capacity to do other things. There's other choices that are available to you. Any of the things that will deplete the enzyme patterns from your heart, particularly CoQ10, things that will offset magnesium and potassium and alter that ratio are going to be problematic. So even though that your diet has been really great, of recent years, a lot of the things that we've done, years ago when I was in college and I was playing ball, I'm nowhere near as good to myself as then as I was today. So things happen. I went to a physician. I go every 2 years and I get a treadmill exam because I like to push myself. I still like to work out. I still like to work out very, very hard. And so this guy that I went to about 7 months ago tells me that I have a small ejection murmur, and that at my age, he's going to put me on cholesterol medications and aspirin and so forth. And I just looked at him and I said, really? And I said, you pick up any signs of clotting? And he says, well, no, but, you have a 12% chance of having a heart attack in the next 10 years. I said, is that guys like me that are in the shape that I'm in? Or that's, other people? He wouldn't answer the question. So the point of it is that first, take a deep breath of air, find out all the information that you can possibly find out about this. Could there be a problem? Maybe. Could there be just a murmur where you're fluttering because there's imbalances, due to other things that is highly, fixable? That's a possibility too, but you got to get all the data.
I can tell you that, we did do an echocardiogram.
Okay.
And I did go to basically like an electrical doctor who diagnosed me with the PVC.
Correct. That's not hard.
Yeah, and he wanted to do an ablation.
No.
And I said, really? I go, you want to go in and kill heart tissue and put a circle around some electrical impulse in my heart? And I go, well, that doesn't sound like we can reverse that. So I said, I'm going to go get a second opinion. So now I'm on my second opinion track. And this guy's, I think he's more of a plumbing doctor. He's gone through as much as what I think is possible without actually going in and taking a look. So, I'm just trying to gear up for that.
Any of the data, stay in touch with me. Just go to rosellecare.com, send me a note, and, I'll give you my opinion and people that I know that are out there that are really top shelf people. But understand that if there's no damage, if they can't find any damage, a lot of problems like what you're describing can be cleared with manual manipulation, acupuncture, and nutrition. We've seen it done hundreds and hundreds of times over the many years. But you got to make sure, that there's no, you're not dealing with a heavy plaquing situation. If that doesn't exist, then there's all kinds of things that if I was in your position, that I would try first before I let anybody do anything, particularly what you're describing. So, Jeff, stay in touch with me, rosellecare.com, and I appreciate your phone call. Coming up to the end of the program, unfortunately, we're done. See you next week. Love you all. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Roselle Center for Healing reminds all women to conduct monthly and annual breast exams and consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.